It's 24 hours to Christmas, and the number of daily coronavirus infections reported by the Nigeria Center for Disease Control is skyrocketing. This is due to increased human interactions as Nigerians prepare for Christmas. Today, the NCDC has reported 1,940 new cases of Covid-19, taking the country's total number of confirmed cases to 233,353. But this figure is minute when compared with what was reported by the NCDC on Thursday. Nigeria recorded its highest single-day infection since the outbreak of Covid-19 in the country on Thursday. And the NCDC reported an alarming 4,035 new cases for the day. Medical experts are now calling for caution as Nigeria celebrates the Yuletide. Joining me via Zoom from Port Harcourt for more on this is a clinical pharmacist, Adaku Efuribe. Adaku, good morning. Thank you for joining us on TVC Breakfast.
Hello, good morning. Thank you for having me today.
Right. What are your concerns with the rising number of cases being reported by the NCDC as we are about to celebrate Christmas?
Well, I have a lot of concerns because Nigerians are getting a little bit laid back about this COVID-19 pandemic. And with the Omicron variant, I'm seeing a lot of people ditching their nose masks, and they're not using their hand sanitizers at the moment. And this is not a good thing at all, because even with the Harmattan season in place, we're at more risk, of catching this virus because the weather is so dry and it's dusty, and also we experience soot pollution in some parts of Nigeria as well. So we really need to up our game at the moment.
So you're saying that the weather is perhaps contributing to the number in rising cases that we're witnessing?
Yes, definitely, because of the way the virus spreads, the dusty Harmattan as well, and with the weather, people are more prone to bacterial and viral infections as well. And I don't think Nigerians, I think they're a little bit, well, I use the word tired with this thing. And, we need to provide more public health enlightenment. I always wear my mask when I'm out and about, even when I'm in a taxi. And we know in Nigeria, the way public transport is, we don't even stick to the recommended number of passengers by the car manufacturer. So we always carry overload all the time. But the weather is contributing, and Nigerians have to go back to those respiratory hygiene and hand hygiene and the wearing of face coverings.
Now, with regards to that, talking about public health enlightenment, how have we fared,
Yes.
especially with our risk communication? Have we done well, perhaps using community communicators to drive the dangers with regards to we not adhering to the non-pharmaceutical protocols?
Well, from my observation, I can see the NCDC is doing a lot of work, especially there's a robust international travel plan in place. We check our temperatures before we go into the airport, and we also have the airport medical team on ground. But in the communities, I don't think I have seen a lot of grassroots public health enlightenment like I would have wished to. So I think the local governments and the communities need to do more in this area, because up there people understand, in the airports and everywhere else. But when you come down to the communities, some people don't understand what the virus is, the mode of transmission. They don't understand social distancing, hand hygiene and respiratory hygiene. So within the community, I think we need to do more as well. Yeah.
Now, what are the implications for us if we are not doing enough, like you are pointing out?
Well, it's obvious. If you're not doing enough, and if you're not pushing more public health enlightenment in the community, at the community level, we may see a lot of cases springing up, especially this festive period, because people will be attending a lot of gatherings. You have things like traditional weddings being slated at this time of the month. You have parties and so many other things, church gatherings, crossover nights and stuff like that. So we may have a surge, especially this December, January period. So everybody has to work hard towards preventing this. All hands need to be on deck. We cannot leave NCDC and the Ministry of Health, we cannot leave everything for them. We as individuals, we need to play our role as well to reduce the possible increase of Omicron variant infection this month especially.
Well, the government is looking to put more stringent measures, perhaps that could curb the spread. Are you confident that would?
Yes, it would help. Like I said, the measures we put in our international efforts, is quite impressive. You can't just travel into the country without following the NCDC protocol. You just have to follow the protocol even, before you can board your flight from where you're traveling from. I think it would help, trying to stop people from bringing in the variant, into the country. It would help a lot. It will go a long way. But like I said, individuals need to stop having this laid back attitude. Like I said, I still wear my mask when I'm outdoors. I still maintain my respiratory hygiene and hand hygiene. But I noticed that when I went to the supermarket, my local supermarket, and I was looking for a particular type of hand sanitizer, and there was none in the supermarket. So what does it tell you? It tells you that people no longer buy a lot of hand sanitizers because business people would stock, things that move. So I was surprised that the spray type of hand sanitizer was not available in the big supermarket. So we just have to start buying those things again, and we just have to start pushing that public health enlightenment more at the community level.
Right. Clinical pharmacist Adako Efuribi, thank you for your time on the program.
Thank you very much. Welcome.